You're listening to PetLifeRadio.com.
The Pet Doctor is sponsored by Ellie Mae Pet Supplements. Visit us at battle-cancer.com for more information on how Ellie Mae supplements can help your dog.
Is your pet stressed out? Does your pet need annual vaccines? Which pet is best for a child? Would you know if your dog was in pain? Pet Life Radio presents The Pet Doctor, where you'll learn everything about keeping your pet healthy and happy. From pet care, pet meds and grooming, to pet food, pet insurance, and dental care, this is the place to find out everything there is to know about pet wellness. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets, because it's your pet. Health matters. Please welcome your Pet Doctor host, veterinary media consultant and veterinarian, Dr. Bernadine Cruz.
As Americans, we spend more on our pets than on candy, toys, and jewelry. We spend more on our pets than the combined revenues from Hollywood's motion pictures, video games, and recorded music. If pet spend in the U.S. were a country, it would be the 65th largest in the world. America is in love with its pets, no matter if they have fur, feathers, fins, or scales. We dress them up. Purchase designer diets. They don't spend the day locked in the backyard. Oh no, not our babies. They have nannies. Which car we purchase is often predicated on which one will best transport our lovelies from daycare to play dates. With all of this pampering, you would surmise that they would be some of the healthiest critters on the globe. But are they? The answers come from Banfield Pet Hospitals, the largest general veterinary practice network in the world. They analyze their extensive database to compile the first ever look at the state of pet health in the United States. Their findings may shock you. I have the pleasure of speaking with Dr. Harry Smith, Medical Director of Banfield Pet Hospitals, South Carolina region. Dr. Smith, thank you so much for being with us. Hold on just a moment. We'll take a short break and be right back.
Please have a seat in the waiting room. The doctor will be with you shortly, right after these messages.
Did you know cancer is the #1 cause of death in dogs? 1 out of every 3 dogs is affected by cancer at some point during his lifetime, and half of those dogs affected die. Shocking, isn't it? Symptoms of dog cancer are nonspecific and often lead to a late diagnosis of the disease. But before it reaches an advanced or incurable stage, cancer exhibits mild but recurring symptoms. If you think your dog is losing weight, has a loss of appetite, looking dull and listless, is non-social, or has any sores, swellings, bumps, or lumps, or abnormal growth anywhere, it's time to visit the vet to make sure everything's well. This message is brought to you by Ellie Mae Pet Supplements. Ellie Mae is an animal healthcare company that creates products which focus on improving the overall health and quality of life for your much-loved pet. Visit us at www.battle-cancer.com for more information on dog cancer and how Ellie Mae supplements can help your dog.
At Petco, we really love pets. There isn't anything we won't do to make sure they're getting the best products and the best care. So when you ask us a question like,
so how do you feel about cat condos?
We can say from experience,
feels like home for her.
Enter the code Dr.10, DOCTOR, the number 10, and get 10% off any order. No minimum at petco.com.
Hi everybody, I'm Megan Blake here with my sidekick, Super Smiley, the giant mutt and spokes dog for throwaways. You're listening to Pet Life Radio, and I'd like to tell you about our brand new show, A Super Smiley Adventure. Our show explores adventures with animals. They can be traveling, out in the world trips, or inner journeys where our animals lead us to inspiration and self-discovery, or just plain fun adventures. Join us here on Pet Life Radio on A Super Smiley Adventure. Good boy.
Let's Talk Pets on PetLifeRadio.com. Welcome back to the Pet Doctor on Pet Life Radio with Dr. Bernadine Cruz. The doctor is in and will see you now.
Dr. Smith, I understand if we hear a little bit of noise in the background, it's people clamoring to listen to what you have to say. You're right on the road right now at a convention, so thank you very much for being with us.
You're very welcome. I'm happy to be here.
So, Dr. Smith, briefly, with people spending so much on their pets, are they really spending it in the right places? Are our pets healthy?
Well, I would say that overall, pets in the United States are fantastically healthy. However, we do have areas where we can improve. There's always room for improvement. And now that we're able to gather data on our patients in numbers that are meaningful, we have found some important trends, and we know that there are some areas that we could, where there are a great area for improvement.
No, I agree with you. I think that the majority of my clients coming through the door with their pets, they are healthy. But before we get into that, maybe you can give a little bit of background on what is Banfield. Some people, believe it or not, may not be familiar with you.
Yes, Banfield Pet Hospital is the largest veterinary practice in the world. We are located, most of our locations are inside PetSmart stores, and our practice has over 7,000 veterinarians in it and over 700 locations across the United States, the UK, and Mexico. So we see a lot of patients. Our records are computerized so that we can gather information on our patients. All of our physical exam findings and medical information goes into a central data bank every evening. So we gather a huge amount of data, and somebody somewhere analyzes that data and gives us great information about our patients and the pet population in general. So we have the opportunity to make a quantum leap in the care of all pets by analyzing data on our patients and learning where we can improve.
Why did Banfield undertake to analyze this data? It seems like information that you would learn might want to be kept close to the vest, somewhat as proprietary information. Why are you letting the world in on your findings?
Well, as veterinarians and healthcare professionals in general, we certainly are a collaborative bunch. We like to get the data out there to make sure that we all can benefit from the data and the information that we collect. Information has been limited in the past to studies that have been done on patients largely at veterinary teaching hospitals. And the patient population is not the same as all the patients that are out there that we see in our day-to-day practices. We have the advantage of being general practices, and we can analyze data from real patients that we see every day in general practice, not necessarily just patients that are sent to teaching hospitals. And that is extremely valuable information. And we have an obligation to share it with the profession.
I remember when I was in veterinary school at UC Davis, we were told about that ivory tower. So here we are in that veterinary school, the clientele that would come to the teaching hospitals. You're right. When all of a sudden we got into the real world, it was a whole different animal, literally and figuratively. Over what period of time has Banfield been able to glean this data? Is it just been the last couple of years?
It's been about the last 11 years that we've been gathering data. And the challenge that we have is we have way more data than we can analyze. We have an entirely different company that does nothing but analyze the data. We call it our BARC company, and they absolutely, that's their full-time job, is to organize and either provide the data to researchers who are interested in the information or analyze it themselves. And so it's a huge undertaking, and one that requires people who really know about data to be able to take advantage of it. And I think like I say, we have way more data than we can get to right away, and more pours in every day. But it's a great problem to have, I assure you that. Eventually, the ability to analyze it will catch up with our ability to collect it.
Well, I know I really find this a fascinating study because colleagues get together. We say, I've been seeing X disease more than I ever really thought I had seen in the past. How about you? So you know what's going on maybe right in your area or at national conferences, veterinarians will chat together. But here now you can really see what your colleagues are truly seeing throughout the United States. Is the UK and Mexican data also in this, or is it just US data?
It's everywhere we have a location, and we do have hospitals in the UK and also hospitals in Mexico. So, and then that's an excellent point. Many of the decisions that we make in practice are made on rumor or information that we gather from one or two other colleagues, or the colleagues that we're friends with from veterinary school, or our professors at veterinary school who we communicate with. And it's fantastic to be able to make decisions based on evidence as opposed to opinion. And it's difficult at times to separate opinion from evidence, but when you collect enough data, then you can gather enough information so that it becomes evidence. And as a practice, we've decided to make our decisions on treatment protocols and vaccination protocols and drug usage based on information and evidence rather than opinion. And we think that that's a very, very important move in medicine.
Well, Dr. Smith, last evening I had an opportunity to go to a veterinary meeting, a local group, and we were talking about canine infectious respiratory disease. And so many of the clients that are listening right now, the listeners, have dogs, they've contracted kennel cough, and we think, okay, it's just this one particular bacteria that's going to be causing the problem. And all right, we'll treat for that. Every time we hear a coughing dog that has a kind of a honking cough and it's been at a shelter or daycare, and we see the sign, it must be disease X. But now we're finding that there are so many other disease complexes that it very much is a complex situation. Having this type of data can really help open a practitioner's eyes to what's going on in their area. And I believe that your study can be broken up regionally. Isn't that correct?
It absolutely can. I wish we had the capability to send that data in a timely fashion to individual locations at this time, but that is coming. We will be able to break this data down into regions of the country, pet population regions, regions of travel where there's a lot of pet travel. All of that information is coming once the research techniques are refined. But yes, we can break that down into regions and locations, absolutely.
All in all, with this particular Banfield study that you've done so far, what are some of the trends? Were you looking for something, or was it just the number crunchers said, we are finding X? What are you finding?
Well, kind of consistent with the scientific method, we let the number crunchers look at the data and then tell us what the data is showing rather than postulating something rather than expecting the numbers to tell us to confirm our suspicions. And we let the numbers speak for themselves. They have told us some interesting things. For instance, the number one diagnosis in pets is dental calculus and periodontal disease, or dental diseases. That is the most common diagnosis among pets, and it's something that, while not entirely surprising to veterinarians, it might be surprising just how prevalent it is and how important it is to our patients. Dental disease is something that traditionally, I think that we have, as veterinarians, we might have looked at that as a reactive problem. We wait and see a patient who has progressive or seriously progressed dental disease and then address it and treat it, when we really have the opportunity, by realizing how important it is, to prevent dental disease in the first place. And that is certainly our goal as a practice, and I know it's a goal in our profession to prevent diseases. And preventive care is one of our areas of focus. And so we have used this information to make sure that our emphasis in our practices and with our patients that we see every day is one of prevention. We want to prevent their teeth from getting disease. We want them to have healthy teeth when they're 15 years old rather than diseased teeth when they're 15 years old.
I have clients when they bring in that new puppy, new kitten, and I'm going through my spiel of this is how you should feed them and this is the vaccines they need, flea control, and all the rest of the various topics. When I hit on dental maintenance and preventive care, they look at me like I have holes in my head that, what do you mean? I have owned pets for years and have never brushed their teeth. Why should I start brushing their teeth? What are some of the ramifications of not brushing teeth? Yes, we know they have tuna breath, stinky breath. All right, we don't want to get kisses, but people don't realize the full effect that dental disease can have on the body. I'd love if you were to say something, Dr. Smith, about that.
Well, I share your passion about dental care. I think it's extremely important. We know that pets who receive regular dental care live longer. In fact, there's very strong evidence to suggest that patients who get their regular preventive care, including vaccinations, examinations, and dental care, live 25% longer than pets who do not get that care, and that is well documented. So we know that it's extremely important for our patients' health, and it does actually make our pets live longer. So it is a big challenge. That's a shared experience, the experience you've had where we talk to clients about brushing their pets' teeth, and they look at us like we're nuts. It is a challenge. I'd have to say it's a challenge for me to brush my pet's teeth. And I think that if we step back and look at the overall care that we can give our pets for their dental health, we can see that regular examinations by their veterinarian is extremely important. Regular professional cleanings, meaning cleanings where they're able to actually clean up under the gum line, clean all the tartar off the teeth, examine each tooth as though it is an individual patient, and then polish the teeth. For most pets, it is on a yearly basis. Some of our pets should have that done on a bi-yearly basis or twice a year. Those things are the most important things we can provide to our pets, and that is entirely doable. That's something that we can schedule and have done at our veterinarians, and we can take care of our pets by getting that done. Doing that alone makes a huge difference in our pets' dental care and their dental health. Then we have the entirely other question of home dental care. And it is difficult. I know it's very difficult to do. Some of our pets love to have their teeth brushed, but I would have to say that it's unrealistic for me to expect that the majority of my clients are going to brush their pets' teeth on a daily basis. However, we do have help for them. We do have dental chews, and these are, in some cases, let's say a piece of rawhide that is impregnated with an enzyme that helps to break down dental plaque. Those can be very helpful if your pet will chew them, and that can be...
And not just swallow them, yes.
Not just swallow. Yes, it has to last more than 3 minutes in their mouth. And I have a pet that no rawhide ever lasted more than 3 minutes in his mouth. But if your pet will chew on them and enjoy them for 20 minutes, then it can make a big difference in the health of their gums. And I think that that's another important distinction. When we're speaking about dogs, the health of dogs' teeth, dogs rarely get cavities. They get gum disease. And gum disease is far more dangerous to the health of the rest of their body than we realize in most cases. Dental disease is an infection that goes right into the bloodstream 24 hours a day, 7 days a week. And it is a very serious problem and one that we do need to address. And the dental chews can help with that. But they will do nothing if our pets don't get their regular professional dental cleanings and professional examinations. And I'll mention that can only be done thoroughly under general anesthesia.
Dr. Smith, I am so glad you brought that up, because many times as I'm talking to my clients, and typically this is going to be a dog, and they say, oh, well, it eats this one biscuit that we've all heard of, has been on the market forever, and it's supposed to keep dental tartar down. Going, in your pet's case, I don't think so. It's just adding to the waistline. But then they'll also tell me that, oh, yes, when it goes to the groomer every 6 weeks, they brush its teeth. I said, well, if you went to your hairdresser and the only time you brushed your teeth was when you went to the hairdresser, you would probably have dental disease also, and this little light bulb goes off. Save your money. Don't have them brush your pet's teeth. You go ahead, put it towards a good toothbrush and toothpaste. We'll show you how to use it. Save those dog cookie coupons and bring it on in. We can go ahead and clean those teeth for you later. They just don't understand, or they just look at the teeth in front and don't take a gander at the ones in the back of the mouth where so often they build up a horrid amount of tartar. Yes, I think dental disease is very, very common. What other diseases did you see that maybe mimic some of what we're finding in the human field as some health issues?
Well, that's a very interesting point. One of the diseases that we see is on the increase is diabetes. Diabetes turns out to be a fairly common disease of dogs, and it's even more common in cats. And it is on the increase. We see more of it now than we saw 8 years ago. So it is increasing in frequency of diagnosis in our pets. And I think that goes hand in hand with another condition that we see on a regular basis, another very common condition, and that's obesity. Our pets tend to be overweight. It is a big problem in our patient population, and there are many, many studies to correlate obesity with the incidence of diabetes. So I don't think it's a big surprise that we're seeing an increase in diabetes when we also see an increase in obesity. But those two things, shame to say, are fairly well mirrored in our human population as well.
It is so hard sometimes. I think a lot of veterinarians are uncomfortable bringing up the subject of obesity when the pet owner is sitting there with the 18-pound cat in their lap, and they say it's a Maine Coon, so it's supposed to be, its daddy was 20 pounds, so 18, it's really slim, when they themselves are overweight, to bring up the subject. But it is such a critically important one. Maybe we can chat about it a little bit more when we come back from this break. I'm talking right now to Dr. Smith. He is with Banfield Pet Hospitals, Dr. Harry Smith. We're learning more about the first ever state of pet health data that has come to the veterinarian's attention and now to the pet owner. So please stay tuned. We'll be right back.
Please have a seat in the waiting room. The doctor will be with you shortly, right after these messages.
Love your pets but wish their medications were a lot less expensive? They are at 1-800-PET-MEDS. You'll not only save on flea and heartworm medications, but on prescriptions for arthritis, incontinence, thyroid, and more. And you get fast service, free shipping, and a 100% satisfaction guarantee. Plus, our licensed pharmacists ensure accuracy, monitor drug interaction, and more. See why over 5 million people have trusted their pet's health to 1-800-PET-MEDS, America's largest pet pharmacy. Call now or order online.
Go to petmeds.com/doctor, DOCTOR, to get 10% off any order and free shipping on orders of $39 or more at petmeds.com.
The Pet Doctor is sponsored by Ellie Mae Pet Supplements. Ellie Mae is an animal healthcare company that creates products which focus on improving the overall health and quality of life for your much-loved pet. Visit us at www.battle-cancer.com for more information on dog cancer and how Ellie Mae supplements can help your dog.
This year, Americans are expected to spend a jaw-dropping $36 billion on their pets. From lighted leashes to high-end spa products, the discriminating pet owner can find just about anything to pamper his or her pet. Hi, this is Michelle Fern. Join me every week for Best Bets for Pets, where we'll talk about the latest pet products and talk to the companies that make them. Best Bets for Pets, every week, only on PetLifeRadio.com.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com. Welcome back to the Pet Doctor on Pet Life Radio with Dr. Bernadine Cruz. The doctor is in, and we'll see you now.
Dr. Smith, you were talking about obesity and diabetes in people, and it is so critical that people realize this is truly an epidemic, and your pet's really not happy when it's fat. Please talk about that a little bit, because my clients hear it and they think that I'm getting onto a rant all the time.
I think that's a universal experience with veterinarians. We all talk about obesity, and I have had clients that have simply made me put a note on their record. Don't talk to me about obesity anymore. They don't want to hear it anymore. But it is, of course, a very, very important problem. It is an extremely common problem in our pet population, and it's important on several fronts. I think one of the first things that our clients think about when they hear obesity is they think about heart disease, and certainly it does affect heart disease in pets.
And many times people just think, all right, I have a chubby pet, and maybe it's not going to be the best for its heart. What other body systems are impacted by this obesity?
That's an excellent question. The number one effect of obesity in pets is its effect on arthritis, and in particular, the effect on the pain that is associated with arthritis. One of the things we know about pets is that, especially big dogs, they're all going to develop some type of arthritis at some point in their life. And everybody's got to put up with arthritis, but pets who are overweight experience far more discomfort from their arthritis than pets who are at an ideal body weight. And that is the number one effect that obesity has. And that, when I see a pet who is obese, that is my greatest concern for that pet, is how are they going to feel 5 years from now when they have a little pain in their lower back, or a little pain in their hips, or pain in their knees? If they have been obese for 5 or 6 years, they're going to experience a great deal more discomfort and therefore need far more medication, far more care, and experience far more complications than patients who lose weight at an early age and therefore don't get that daily wear and tear on their joints.
What I think a lot of people don't realize, Dr. Smith, and it goes along with that so completely, they have an ache and pain for themselves, they want a pill. If their pet, if they finally realize that, gee, it's just not getting up slow, doc, because it's old, but there really is a medical concern like arthritis, well, just give it a pill. Going, yes, there is medication that can help, but I always tell them the most important thing they can do is get the weight off. It's going to be easier load on those joints. And so many people don't realize, and I think some veterinarians also, that the fat, especially the fat inside of the belly, is very, very chemically active. And many of the chemicals that the fat produces inflames the joint. So, gee, get that weight off. You're going to have a win-win situation. Tell people you're going to spend less on dog food too, so you're going to be winning there also. But yes, I think that it's a huge problem. And you were talking about big dogs getting arthritis more often. In your studies, what did you find, or did you find differences in big dogs, little dogs, in disease prevalence? Is there a difference, or do they all kind of get the same thing?
Our data hasn't been broken down into big dog, little dog data just yet. We do expect to get that, but we don't have data on diseases versus size of dogs at this point. We do know that all dogs are at great risk at all times for things like heartworms. We know that heartworm disease is still very prevalent, even though we have fantastic medications to prevent heartworms. But we don't have the data just yet on disease prevalence, big dog versus little dog.
How about age differences? Because I know you looked at a broad range of, your pets that were coming through the door. And how many dogs, how many cats did your data review?
Our data is, we collect data on millions of patients every year, and so studies are broken out into subsets. And so most of our studies involve over 1 million patients. And so we have a vast array of patients in almost all of the studies that we do. And we know, for instance, that older pets are diagnosed with far greater frequency for the things that we would expect, things like liver, kidney, and heart disease. But a very interesting part of our study shows that those who have periodontal disease or dental disease also have a much higher risk of developing kidney, liver, and heart disease. And it's a logical conclusion. It's something that we've known in human medicine for a long time. And it's gratifying, I think, to understand that that does actually happen in the canine population and the feline population as well. So that dental care is important not only to prevent things like toothaches and bad breath, but also to prevent disease to other body systems like liver, kidney, and heart function.
But Dr. Smith, again, I'm speaking with Dr. Harry Smith. He is the medical director of Banfield Pet Hospitals in the South Carolina region. Oftentimes I'll have clients who say, okay, yes, I realize the teeth are bad and I should have had it done before, but gee, doc, it's old or it has seizures or, I had a dog 10 years ago that died under anesthesia. I'm afraid to do this. What is your response to that?
That's a wonderful point, and it is a very important point, one that our clients are very concerned about. And I think one of the most important things we can do as veterinarians is make sure that we are using absolutely the latest, greatest, most up-to-date anesthetic protocols that are available, because anesthesia is a frightening thing for most people, and it's frightening to think of our pets having to have general anesthesia, and it's a little bit of a disconnect to think about our pets having to have general anesthesia in order to have their teeth cleaned and to take care of their dental problems. It is an absolute requirement to do it properly, but it's also important to understand that anesthesia has been improving by leaps and bounds, and even in the last 2 years, there have been huge improvements in the safety of general anesthesia. I know in our practice, every year we review our anesthetic protocols. We have outside anesthesiologists come in and review our protocols to make sure they are absolutely the safest and most effective protocols available. And by protocols, I mean, what drugs do we use? What procedures do we use? How do we monitor our patients under anesthesia? And how do we care for them both before and after they have a general anesthetic? And the safety of general anesthesia has improved vastly. And now the risk of periodontal disease is far greater than the risk of general anesthesia. In fact, it's so much better for pets to have general anesthesia every year and have their teeth cleaned than to suffer from periodontal disease because of that safety factor in general anesthesia these days.
I think for the listeners, they will always have their concerns, and the best thing you can do is what you're talking about right now, asking their veterinarian, what preoperative things do you do? EKG, for instance, blood work. How do you monitor the pet while it's under anesthesia? I think many will be surprised to find it's so many of the same procedures that are done when you and I, Dr. Smith, are under anesthesia that are being done for their pets. How do they monitor them afterwards when they're waking up from anesthesia? And I will tell these people that, you know what? Let me do this, and then the onus is up to you. You don't like the idea of your pet going under anesthesia twice a year? Great. You start cleaning those teeth more often at home, and then maybe I won't need to. But we're both concerned about that long-term health. With the study that Banfield has done now with the State of the Pet Health Report, were there any findings that really surprised you?
I think the thing that surprised me the most was the prevalence of heartworm disease. As veterinarians, I think we sometimes...
And that's 100% preventable disease too, isn't it?
Absolutely, absolutely. And that's the very reason that it was such a surprise to see that heartworm disease is still quite prevalent. It can be up to 6% of the canine population in certain areas that are infected with heartworms. And these are canines that are cared for by people, not wild pets, but pets who live in our homes. And in a disease that is 100% preventable, it is absolutely astounding and shame on us that we still see heartworm disease in dogs when we know we have fantastic procedures and medications to help prevent heartworm disease. And I think it comes down to the same thing that happens to us when we go to the doctor. Quite often we get medications and we take them until we feel better, and then we stop taking them, even though we know full well they told us when we left the office we were supposed to take it till we finished it. A lot of our clients, they purchase heartworm preventative, and then either they forget to give it to their pets, which happens to me on a regular basis, or they just decided it's not that important. And I was astounded to find that among clients who bought heartworm prevention and took it home for their pets and had good intentions, only about 30% actually gave it on time to their pets. So compliance is a huge problem, and by that I mean getting the medicine into your pet on a monthly basis is still a difficult thing to do. And so I think that was the biggest surprise to me, is the fact that we still see heartworms in such great numbers.
Now, I have to say something. You are only talking about dogs, but cats get heartworm too. And that seems to be the real silent killer, where people have heard about it. Veterinarians tend to talk more about the dog with heartworm disease, but cats can get it. And I think what's so frustrating is there's not a test that we can do to 100% say it does or does not have it, just because of the cat's unique immune response to the heartworm organism itself. But the treatment for it can be pretty much non-existent, symptomatic care, but there are safe, effective things you can do even for that indoor cat. Talk about that, please, a little bit. Even indoor kitties need protection.
Absolutely, and that is, I agree with you 100%. Feline heartworm is one of those diseases that we understand more and more about every year. We get more information about what devastating effect heartworms can have on cats. And we've ignored that for a long time as a profession. But we know now that heartworm disease affects cats in so many ways. There are so many respiratory diseases and other system diseases that we see in cats that are influenced by heartworms that, as you mentioned, we can't really diagnose. We don't have a test that could connect those conditions directly to heartworms, but because heartworms don't develop into adult worms in many cases in cats, they have an effect way before they can be detected. So it is a very important, and it's probably more important than we even realize. But we do have effective prevention products for heartworms in cats. There are topical medications that can be applied to your cat on a monthly basis that are easy to apply, easy to do, and not only prevent heartworms, but can also prevent fleas. And we're all concerned about fleas, but it's wonderful to use a product that not only prevents fleas, but also prevents heartworm disease in cats, something that I guarantee 5 years from now, we'll understand that it's a far bigger problem than we even know today.
I think that you've hit it right on the button. Kitties need to have this preventive medicine. Here in Southern California, and say in the last month, we're at the end of summer right now, we're probably still in the middle of summer for Southern California, we are seeing so many fleas. And I'm telling people, I think the fleas think they've gone to South Carolina. The humidity and the heat, it is just, they're exploding. The medications are working that they're using, the topicals that you hear about from your veterinarian or on the news. These things do work. You just need to do the environmental control as well as treating the pet and keep at it. Don't get lulled into this false sense of security. I'm not seeing fleas. I'm not seeing mosquitoes. There can't be a problem with that. The poop looks normal. There can't be internal parasites. But there can. Things can run in the house like a little mouse that your cat finds and never going to tell you about. So you definitely need to keep up on this to safeguard their human health as well as their pet health. And speaking of safeguarding, what can people do to safeguard their pet's health? What's come out of this study?
Well, I think the number one thing is the importance of their basic, regular, preventive care. We now have definitive proof that preventive medicine makes our pets live longer. And that message is so important. I want to shout it from the rooftops because, fixing a broken leg is very satisfying as a professional, but making my patients live 25% longer is so gratifying. There are no words to express how gratifying that is. And that is preventive care, meaning regular examinations by your veterinarian every 6 months at a minimum, regular dental care, the preventive vaccinations that are available and that are indicated for your pet, the preventive testing, both blood, urine, and fecal testing that is recommended for your pet by your veterinarian. When those things are done, when your pet gets their regular preventive care, it's been proven that they can live up to 25% longer. And there are not many medications that can guarantee that, but preventive care can. And it's something that, as veterinarians, I know I can speak for myself sometimes. Preventive care is not the most exciting type of medicine to practice. However, it is absolutely the most gratifying as a professional to know that I can have such a huge impact on my patients' lives simply by making sure they get their routine preventive care.
Well, Dr. Harry Smith, I think this has just been wonderful what Banfield Pet Hospital has done to glean all their information, to find the data, to show the American veterinarian as well as the American pet owner what they can do to keep that pet healthy. And yes, well baby checkups. I love having those well baby checkups, doing blood work and calling them afterwards and saying, it looks like a teenager inside, doing that poop exam and finding nothing. The urine is normal. I love giving that type of news. And you're right, coming in for those checkups usually twice a year is spectacular, at least once, even if your pet looks healthy. So I've been speaking today with Dr. Harry Smith. He is the medical director for Banfield Pet Hospital in the South Carolina region. Thank you so much, Dr. Smith.
You're very welcome. It's been a pleasure. Thank you.
Well, please tune in again next week when we'll have more information on how you can be the best pet owner possible. Thanks for listening.
Pets can be a wonderful addition to your life. Keeping them healthy and happy is important. Pet Life Radio presents The Pet Doctor with veterinary media consultant and veterinarian Dr. Bernadine Cruz. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets. The Pet Doctor, on demand every week, only on PetLifeRadio.com.
The Pet Doctor is sponsored by Ellie Mae Pet Supplements. Ellie Mae is an animal health care company that creates products which focus on improving the overall health and quality of life for your much-loved pet. Visit us at www.battle-cancer.com for more information on dog cancer and how Ellie Mae supplements can help your dog.